the poll.
Thank you, Adina. The poll is set up in Poll Everywhere, which you may already have on your phone, in which case you can open the app and put in UNE CAIEP, which will take you to our poll. You can also get it on a browser, or you can text UNE CAIEP. You can see that instruction in the lower left-hand corner. And our question in the poll, what does advocacy mean to you? We'd love to hear what it means to you. And I want to take just a moment to welcome everyone. And if you haven't attended a University of New England CAIEP Knowledge Exchange before, our agenda for the hour is to start at 12:05. We'll have some discussion with our esteemed panel, and then we'll have a breakout room of about 15 minutes, and that's designed to give you a chance to meet students and learners from other professions and have an interprofessional conversation for a little while. Then we'll debrief that conversation, and we'll be done at 12:55 so that students who need to move to their next class have a little bit of time to do that. So thank you for your participation. Thanks, Adina, for hosting us.
Of course. Thank you, Chris. We have lots of words coming in as we think about advocacy. Panelists, would you like to take a little, pick some words from here and talk about them very briefly? We have just a few more minutes before we start officially.
Yeah, I was trying to take a look at what was kind of popping up. It's so rapid fire, but there's one big word that seems to be kind of at the center of everything. Support, and that makes sense to me as a professional association president. So much of what I'm doing is supporting the physical therapists of the state, and what laws, legislation is going to help people feel better supported. But I see a lot of like listening, empathy, those kinds of things popping up as well. For me, that's a really big part of it is what change needs to happen, starting with that. Kevin.
Yeah, I was going to say, Marissa, I really loved that listening keeps clearly being a bolded word. I think in these times, it's really important to listen. That's the thing that I love most about being up at the State House. I feel like it's such a privilege to be able to be amongst so many different views so that we can craft legislation that is the best possible piece of law or work group or whatever comes out of it for the state of Maine. I think that's such a key piece of it.
Yeah.
Mm-hmm. I just saw randomly on here, trying. Sometimes that's what it feels like. It's just try. Like everything is a work. You have to make a team every day, every year, try to make things a little bit better. It's just trying. I just saw that. I was like, oh my gosh, that's what it feels like. Like I'm not going to change the world today, but maybe with all the right people on my side and keep working and not giving up, just keep trying.
Yep, trying for that collaboration. I really want the person who decided that cheese was an important part of advocacy to expand on that in the chat.
I mean, I like cheese. It's delicious.
I was thinking about cheese in the context of the patience it takes sometimes to get the right end product. And there's a lot of patience needed in advocacy as well.
Yeah. Oh, you got to make the cheese slowly, Kevin. I like that. I thought you meant patience as in people, but you're talking about patience with a C.
Oh, right.
Patience with each other, patience with the systems.
Yeah, democracy is not known as being quick and efficient, but it does work to try to get everybody involved.
Excellent. Welcome, everyone. Just a quick note, we are officially beginning at 12:05. And until then, if you can take a minute to participate in our poll. The question we have for you is, how would you define advocacy in one word? And we already have several answers on the word cloud. Please take a minute, and Chris Holt, CAIEP director, will let us know, will share with you how you can participate in the poll.
Thanks, Adina. So if you have Poll Everywhere on your phone, you can just open the app, and there is a way to do it on the web and by text, and that's shown at the top of your screen here. If this is your first University of New England CAIEP Knowledge Exchange, we welcome you and want you to know that we'll have 20 minutes or so of conversation at the top of the hour. starting at 12:05. And then we'll be in breakout rooms for about 15 minutes, which will give you a chance to meet learners from other professions and discuss the issue that before us today and learn about from and with each other during that time. Then we'll wrap up and we'll be done by 12:55 to give students a chance to get to their next classes, or for those of us who have meetings at 1 to get to those. Thanks, Adina. We're about a minute out.
I just wanted to highlight Brave. I feel like this is something that for me, since I'm up at the State House in Augusta all the time, sometimes it feels like a summer camp because it's like everyone hangs out there all the time. But I always feel like when advocates who are not traditionally up there show up, they're so brave because it's like, what is this experience? And I think that's the cool thing about learning more is that you realize that it's not that scary, that the legislators are people just like us, and they really just want to learn more. And so I think that's the cool part about living in Maine, especially, is that I think it is accessible once you just figure out where do I park, which is it's a tricky
Ooh.
answer.
Oh my gosh, yeah, as long as I didn't park when I went up there at the sign that says do not park here if you are not a legislator.
I wouldn't park in the parking garage either. Suddenly it was open and it wasn't open before, and I don't feel like they did any sort of stabilization on that parking garage.
I literally do not know where that is, so.
Yeah. See?
The logistics are so important.
Yeah, as long as you can figure out where to park, or if you're just willing to walk a mile and just pop into random buildings, that was the hardest part for me too.
All right, Adina, Dave and Lee and Michelle, are you ready?
We are ready.
Okay, Adina, take it away.
Thank you, Chris. Welcome everyone to the Center to Advance Interprofessional Education and Practice. Today's session is titled Advocacy is Interprofessional Practice. This session is thought of and organized by Marissa Leon, Associate Professor of Department of Physical Therapy and President of the Maine chapter and of the American Physical Therapy Association. We would like to welcome our UNE students. It is great to see so many professions identified already in the chat. We have medicine, dental hygiene, public health, among others. Would also like to extend a warm welcome to our community members, prospective students, alumni, and students from other universities. We are so glad you're joining us here today. My name is Adina Robinson, and I'm an assistant professor of marketing in the College of Business here at UNE, and I will be your host today. Together, we will explore the roles that healthcare professionals play in advocating for the change on a local, state, and national level. We're excited to discuss with you interprofessional approaches and advantages to healthcare advocacy, and especially how each one of us, students, faculty, administrators, and community members, can strike collaborations to advance healthcare advocacy. And a quick note, near the end of the event, we will share a survey link that will record your attendance and our attendance and participation. So please let us know how we did today by completing the survey. Next, we can move on to our learning objectives, which are also in the chat. And briefly, we'll focus on understanding the roles and responsibilities of health professionals in advocating for systemic change. And we will do so by looking at a recent health bill in Maine. It is bill number 1496 that eliminated recurrent prior authorization, usually requested by insurance companies, for people with chronic and long-term medical conditions. This bill was put forth so that Maine patients can stay in care longer and access medications more easily, while clinicians spend less time on paperwork. As we listen to our panelists, another goal for all of us, is to identify ways in which we can apply these learnings into our future clinical and advocacy practice. Now, I would like to ask our panelists to introduce themselves briefly share with us how they interacted with the 1496 bill as it came to life. Again, this is the bill that provides ongoing access to medications and care for chronic and long-term conditions. Maybe we can start with Anne, Kevin, and then Marissa. Marissa will walk us through the path of this bill.
Hi, all. My name's Anne Sedlak. I use she, her pronouns, and I am the Director of Advocacy at the Maine Medical Association, which is, we represent about 4,300 residents, medical students. I know some of you on the call are medical student residents, and physicians, both allopathic and osteopathic. I've been in this job just over 2 years now, and it's been such a privilege to be able to work on healthcare law and kind of be up at the State House, but we also work down in DC on other issues down there. I will note I just put in the chat the bill information. And so this was a bill that some of our members reached out to us about wanting to pass in Maine. It has not been passed yet. So I just want to clarify that it is still stuck on the appropriations table, which I'm sure Marissa will get to in a bit. But it is one of those things where all of you, I hope, join your associations at some point, because that's how bills become law. We hear from clinicians who say, I am having such a hard time getting my patient access to this care. There must be a solution. And we listen and we try to think about, okay, what's a way that we could either do it through passing a law or some other mechanism? And so we heard from our members that we need to do this. And then we realized that I'm sure there are other clinician groups that are also struggling with this. And so we formed a kind of a crew, I would say, of I think 10 plus different associations that kind of all work together to coordinate, to show up at the public hearing and kind of press legislators on the importance of this. So it's been a joy working on it. We got successful votes in the House and Senate. All the Senate Republicans voted for it, I think, at like 2 a.m. in the morning, and I really appreciated that. One of them texted me saying, all right, I got them all on board. We are stuck trying to get funded, and we're going to continue working on that. I'm sure we'll get into it, but it's been great working on that issue and other along with our colleagues.
All right. Thank you, Anne. My name's Kevin Lewis. I'm the president and CEO of Community Health Options. It's a health plan that I started back in 2011, and it's been a joy to bring new thinking and ways to work in partnership with providers and members to really, in our mission-based approach as a nonprofit, the only domiciled nonprofit here in Maine, to provide affordable, high-quality benefits that promote health and well-being. I would just indicate, we oppose 1496 as it's written. It's not because we lack empathy. We certainly want to drive down administrative costs and make things easier for providers. Our opposition is mainly due to the unintended consequences that we see arising from the bill. And really wanting to work on those unintended consequences before they would come to pass. And I would just say I think we are in violent agreement on some of the end game, which we can talk about, where we want to get to. And part of the issue we have with 1496 is taking away some important tools in a currently very dysfunctional system before we can actually change the rest of that system so that we can all benefit and reach that end game together. So I'll just mention it's always a pleasure to work with the Maine Medical Association. We often are working on the same side of issues. At times we are not. And this goes back to my days when I was at the Primary Care Association. I led the Safety Net Association for over a decade, and had the pleasure of working closely with Gordon Smith and then, of course, Andy McLean. So with that, I look forward to the discussion, and I'll turn it over to Marissa.
Yes, so I think I fit chronologically in talking about how I became involved with this bill. So as Anne mentioned, she had a connection with a provider who proposed kind of an issue that she wanted to help find a solution to. The Maine Medical Association joined up with some other associations, found a legislator to draft the bill. Kevin, at that point, I believe, had awareness and connection. And then as the president of a smaller professional association, the Maine Physical Therapy Association, we employ a lobbyist, as almost all of these associations do, and providers. And I became aware of this bill when our lobbyist had it as one of the bills that was being tracked that would potentially affect physical therapists. And we were in support of the bill, and our lobbyist asked me to go to Augusta to testify in support of it. And that was my very first experience ever going to Augusta, ever testifying. My term started this last January, so I've been doing this for about a year. And then I ended up meeting the lobbyist for the healthcare organization that Kevin works for, and was able to connect with her as well. So I had my very first experience testifying for this bill and kind of understanding the legislative process there.
Excellent. Thank you, Marissa, and thank you, Anne and Kevin. Maybe we can talk a little bit about how a bill becomes a law while referencing this bill, and then we'll get into a few questions.
Yes, great. Do you want me to walk through this, Adina?
Yes, please.
Okay, great. Anne and Kevin, please correct me if I misunderstand anything on the steps. So how a bill becomes a law, I'm focusing on the state of Maine. There's a lot of things about this that are similar when you're thinking about Washington, D.C. So in thinking about the bill that we're discussing here, like I said, a physician had a problem related to prior authorization and having to request prior authorization many times for patients who had these chronic conditions that needed the same care over and over. And so had this issue and contacted the Maine Medical Association, who then worked to kind of have some draft language. Eventually, the bill needs to be written and proposed by a legislator. There's a former physician who's a legislator in the Maine Senate, and he was the one who, with his staff and with the associations, kind of proposed this language, was able to propose this bill. He got a couple of other co-sponsors on, so that's other senators for the state of Maine and representatives for the state of Maine in the Maine House. These people join on as sponsors, and so now these are kind of like the official people who back this bill language. Then they file it. It gets printed, which still confusing to me exactly what that means, but it means it's kind of like officially on the record of here's all of the language of the bill. And then eventually some committee has to see it. So there's a bunch of different finance committees, healthcare related committees, but in order for the bill to get passed through, it gets filed in one specific committee. So it has a number, it has language, it's been assigned to a committee, and that is where we kind of move forward into step 4. Yeah, there we go. It gets a hearing. This kind of seems to be the exciting part, and Anne can maybe attest to this. The exciting part. Yep, Rep. Zager was our wonderful representative who sponsored this bill, where you're not always sure which bill is going to be heard in which committee hearing. And so you're kind of checking the schedule every day, every day. This is why we pay a lobbyist, because I don't have time for this. And then this is why the lobbyist sends info to me. And then as the association president, I send it out to my members. Once you get assigned a committee hearing, if it's super important, then you get everybody on board. You can either have testimony submitted in writing, in Zoom, or in person. Then the committee hears all of the testimony, takes in everything that everybody said, either neutral, for, or against, and then they have a private session without the public. They decide after talking for a while whether they want to vote on yes, it should pass, yes, it should not pass. And then from there, it passes out of committee, or it ought not to. It does not pass out of committee. Then it goes forward and it is voted in the overall House or overall Senate. This is probably a process people are familiar with in DC. A bill kind of has to pass both houses, and then it goes to the governor's desk. And Chris, if you can move forward to the last step 6, 7, 8, 9. But before it gets to the governor's desk, if there is any chance it is going to cost the state of Maine any money, it has to go to the appropriations table, which is the money people table. And that's where this current bill is actually stuck. So it passed through committee. As Kevin mentioned, me and Anne and the lobbyist for community health, we all testified. It passed the House and Senate. There were some amendments, I think some small, and now they're working on determining how much it's going to cost and whether the governor will sign it and whether it will move forward based on all that cost. And any corrections or modifications to the rapid fire how a bill becomes a law process?
No, I think you did a great job. And I think the thing I always say is that you do not need to know this to show up to the State House. I think that's a really key thing. I feel
Oh
like
my
the
gosh,
clinicians
no.
themselves, you all are experts in your field. You don't need to be expert in the legislative process. You just need to be an expert in, okay, I can write something down or I can show up and testify. And there are people out there who are willing to help you get up there or testify via Zoom or even just submit written testimony online. So
Yeah. I think
But
a
I think it's
very, very
helpful.
small understanding that like you're at the very kind of beginning phase and that your association often is doing a lot of the work of this for you, for drafting the language and helping you understand how to testify. For me, that was really helpful to understand like, I have someone that's got my back that knows how all of this works and they're going to step me through the process.
Excellent. Thank you all for introducing yourself, for the recap, and telling us about the bill. Maybe we can jump into a few questions. This is a question for all of you. Not all proposals make it all the way up to the appropriation table, to the money table. What was different here, and what hurdles were overcome, given your experience with this bill as well as other proposals? And specifically, did different parties have to come together to the table and work together?
Well, I mean, you always have people opposing you like Kevin, but that's just the process. And I think it's actually a good process because I think it's important to have, a different set of opinions. Well, I think one of the things we do is we listen to opposition. I try as a lobbyist to always think, okay, what are things that we can change? So the original proposal was you wouldn't need to get a prior authorization for something like a prescription medicine until every 5 years. We moved it down to every 3 years because we recognize that sometimes it does help to kind of get that prior authorization, check in with the health insurance company. And so that was kind of things that we worked on in that committee process. The thing that I don't love about the appropriations table is that you're competing in some really good bills. Right now, I think Maine is facing a big cliff around the effects of the federal government, around HR1 and getting people enrolled. And so it's going to be tricky going through. We got a fiscal note because the bill affects the state employee health plan, and that they're alleging that this is going to increase costs for members. I'm sure Kevin would agree that it would increase costs for members. I don't agree with that. These are services that members can already access. There's a lot of evidence around the fact that most prior authorizations, when you fix your signature or, check that final box, get approved upon that final appeal process. But I'm sure Kevin's got some point of views of that it would affect the state employee health plan. So that's why we're working right now to kind of see if there's ways. It's right now, I think, a $2.4 million fiscal note. So they're saying that it would cost the state employee health plan that much per year. So we're trying to show evidence that prior authorizations are adding more administrative burden, which drive costs. But I'm sure Kevin and others would argue that it's accurate, like that will drive it up. So I don't know if Kevin, if you want to add anything on that.
Well, yeah, thanks, Ann. I can't speak for the state employee health plan per se, but there is a concern in terms of the 3-year horizon for some drugs. I take Stelara or Humira, where biosimilars have come into the market that are really important alternatives that can provide the treatment effects desired, but at a much lower cost. So as we pay attention to both high quality outcomes as well as the benefits of coverage, we also want to make that coverage accessible and affordable. And so having the ability to have biosimilars play an important role without being stuck with a 3-year prior auth to a very high cost specialty drug is an important consideration of ours. And I would say that some of the issues of 1496 were resolved, can be resolved in other ways. So that was we try and find non-legislative solutions where possible. And I think one of the differences for this past couple of years is just the palpable frustration with, barriers, which we recognize. And it gets back to what I was saying earlier in terms of a different way that we can work together to achieve better outcomes at lower total costs.
Yeah, and when I get involved with these things, I think as a physical therapist, I'm a pretty big proponent of having really big conversations about prior auth. Physical therapy costs on average $50 to $350 a session. So say someone goes twice a week for a month, you're looking at 8 sessions, maybe you're looking at $1,600. Humira for 4 weeks costs between $7,000 and $15,000. So I do get a little frustrated sometimes when something that costs $100 requires a hour-long phone conversation for prior auth. And so I think sometimes with me, yeah, it probably will cost them a little bit more. Is it going to cost them $2.5 million? My assessment is probably not. And so working with the Maine Medical Association to, provide information and letters to the state of Maine. Hey, it might cost more, but here's proof it's probably not going to cost you $2.5 million more dollars.
And I think that's the fun part about being up at the State House is that we get to have these disagreements. Like I feel
Right.
like so many times in this world we're like, oh, we can't talk because we're going to disagree. No, that's the fun part. And
Right.
I learn something from Kevin, from Marissa as a clinician every time I go up there and put an idea up there, and it definitely crafts my thoughts for future use. I know, Kevin, one of the thoughts that you had raised or your lobbyist had raised is that there's now a process to kind of get more data on prior authorizations, and the Bureau of Insurance is working on that data. And so then we can kind of craft, okay, focus in. Here's where we really need reform. And so I think that's the cool part is that it's not a one-day thing. We're in this for many, many years, and how can we constantly work together and maybe disagree this time, but agree on a future time.
Yeah, and I would put this in the context of what I think we're going to be seeing this legislative session, which is pretty exciting, which is a pretty significant overhaul or potentially overhaul of how we can manage costs. And so if we can emphasize use of primary care and physical therapy and avert downstream costs, that's part of a winning solution where if we can have delegated authority to providers and capitated payments that put performance risk with providers, but the insurance risk stays with the carriers, and have some risk corridors and ways to buffer, make sure that no one gets on the wrong side of that equation. I think we can really achieve the desired, reduction in administrative burden, and also get people sort of into the fast lane to services that we know have a significant benefit. So it part of that greater context is really important to us in making sure that we're not, again, taking something away in a dysfunctional system without addressing the dysfunction as it exists.
These
Oh,
are
and I would,
excellent points.
Kevin, I'm going to ask
Thank
you a
you.
question. If
Sure.
I'm Chat GPT and I say, Kevin, that was really beautiful, but explain it to me again like I'm a third grader.
These are excellent points. And I think we can really see the different parts that come and advocate across discipline for a bill. And as we have our attendants looking to engage in health advocacy passionately as all of you are engaged in with this bill, I do have a follow-up questions. You've covered a lot of my questions already. Thank you. But and this is for you. How can clinicians start the advocacy process? A lot of us work with patients. A lot of us do see the shortcomings in the system. And a lot of us are looking to engage in advocacy. How can they start? And does it always look like sponsoring or testifying for a bill?
Gosh, I love this question because I usually have a pyramid chart when I do this, when I do my how-to, and I say that you are already advocating in your every single day life. I went to law school, and the dean of the law school told us when our first day of classes is that it is a privilege to get higher training, and you should be using that in when you're talking to patients in the community. People are going to trust your voice. And so when you have a conversation at a grocery store, that is advocating. But then you can kind of level up and take different levels. I like letters to the editors or op-eds in your local newspapers. I think that's a great way to kind of share your perspective. It's very low stakes. You can kind of pick an issue of the day and kind of send it in, and there's a great resource around that. I'm happy to share it with the students around like how do I even write a letter to the editor. But then getting involved in the State House, get involved in your associations, or there's tons of advocacy organizations that are looking for voices. They hear from lobbyists on an every single day basis. They don't care what I have to say. They want to hear from you all. So just get involved with organizations because they are built to help you get involved.
Thank you. This is wonderful. And another question, a follow-up question for all of you. Are there any skills, behaviors that you would like to see more of from our health professionals, or even communication skills such as listening, framing issues, share language? What is it? What are the gaps that you are now seeing in this advocacy process?
Kevin, I'd actually love to hear your thought on that. I have a quick answer too, if we want to finish with me, but I think you're
Well,
talking to clinicians, and sometimes when it comes to insurers, people start with, I have a list of things I'd like to complain about. And it doesn't start with listening and a conversation.
well, yeah, I mean, I think we like to be involved as early as we can, talking with clinicians, talking with health providers and health systems. Great example, St. Joe's Hospital. They have a opioid recovery program, and they wanted to be able to manage, the entirety of that, including the sourcing of the long-acting buprenorphine. So it was an outreach to us, which I welcomed, and we were able to hash out an agreement within 30 minutes over the phone with our director of pharmacy. And it's a small population, but it's very meaningful for that program and those people. So I guess the point I'm trying to make is it doesn't always have to come to a bill. And sometimes the wins that I've experienced are things that either never made its way to a bill or were a bill or became a bill, but then died because we had some administrative solution that we were able to work through. So it's really, I think, back to that word cloud about that listening, collaboration. What is the true win we're trying to achieve? Working on that together.
Yeah, and I'd say my answer is being a part of your association, paying the fees. It's a different amount for different associations, and then reading your emails. A big part of our budget is paying people to keep track of these bills, to have relationships with lobbyists or with legislators, with insurers, and then just kind of like Kevin mentioned in the chat, if you have an issue that you're interested in, you can listen into a session, and then that way that might kind of reduce your fear of submitting a testimony in person or in writing, and then just kind of keeping up to track up to know kind of what the issues are that are being discussed.
I'll just chime in. I know we're about to move, but I will just say a lot of associations waive, like I know Maine Medical Association waives the fee for students. So I know a lot of UNE's medical students are one of our student members, and you're just in it already. So check in. They might not even have a fee associated with it.
Yeah.
Excellent. Thank you. We have just a few more minutes before we get sorted into breakout rooms and discuss in a smaller group. But before we move on, I do have one last question for all of you. And all of you are sitting in different areas, but we're all collaborating. From your point of view, what is something you would like to see changed differently with respect to advocacy? What would be something that would help you in your role push these healthcare bills or changes in our own offices forward? Marissa?
Yeah, I think for me, it's knowing what members want. So having member engagement. Obviously, I know what I want in the clinic for me, but as someone who's representing, the 500 physical therapy members in our state, if I don't have engagement for all 500, if I only have engagement from 2 and I know what they want, well, then that's what I'm going to do in the state house. And so just having more voice so that I can do the work, even if they never go testify. If I know what the physical therapist of Maine, what they're having issues about, then I know to kind of focus my work and our budget in those areas.
Excellent. Thank you. Anne?
Mine is it's simple in its words, but it's not as easy. The legislature moves slowly. They have this thing called legislative time, which means if they start at 1 o'clock, they'll probably start at 4 o'clock, and that is not easy for you all. It's one thing I hope to slowly work on as I work at the State House, because I think it's really inaccessible sometimes, but I still think you should try.
Thank you. Kevin?
Yeah, just two things. First, I think recognition that the commercial market and ACA market that we're in is just less than 25% of the total total population. So Medicare and Medicaid are really vital to the whole ecosystem, and paying attention to that as well. And then the second is at some point, we're all going to have to figure out what we can give up while then also achieving what we can pull together as an entire ecosystem. So by that I mean there are some sacred cows out there that we may have to relinquish in order for us to get to a better end state. And that's going to take a lot because we have a lot of vested interests, and there's a lot of money that comes in from out of the state that unfortunately skews the dynamic. So just some
Thank you.
thoughts.
Thank you all. This was an enlightening discussion. I really appreciate your efforts, your work so far, and your participation here. So now we will be moving into breakout rooms. Please turn on your videos in the breakout rooms if you can, and be ready to introduce yourself and your profession or role. If your breakout room does not have a designated facilitator, please take the lead, start being the advocate, and introduce yourself and address one or more of these discussion prompts you see here. They'll also be in the chat. Also, quick note, please assign a scribe and have your takeaways from your group discussion ready to drop back into the chat when we return, and we'll be back here together in about 10 to 15 minutes. Thank you all, and see you shortly.
Folks, we're just going to let the breakout rooms empty and we'll get back to our discussions. If you have notes from your breakout room, please go ahead and drop them in the chat now.
Welcome back, everyone. Welcome back. Thank you, Chris. Okay. Thank you, everyone. We had a lovely discussion in our breakout rooms. I would like to invite the scribes for each breakout group to go ahead and drop their takeaways into the chat. Our panelists had also joined the breakout room, so I would like to invite them at this time to share a bit about their group's takeaways. If they would like to. I can start by sharing just a few things that the students pointed out. One that we don't hear that much directly from the patients. We hear about the patient through the expert's point of view, but sometimes a patient's perspective through their voices gets lost, and that's something that we need to add back in. There's also a lot of advocacy that happens on the UNE campus through the student organization, through the Students Osteopathic Association, and that's a great way to engage in that. And we've also learned about an advocacy mixer on the Portland campus. So anything else that the scribes would like to share, and the panelists? Maybe we can start with our panelists.
I'm happy to start. I feel like I need to say this. I said in the moment, but somebody had mentioned that, well, they don't have a lot of experience yet, so they haven't chimed in. And if that's the biggest takeaway I can have, is that you don't need a ton of experience. I wish I had examples of testimony I've seen where it's 2 lines saying, I don't agree, please don't vote for this. You can chime in, and it's just important to show that you support or you don't. So never feel like you don't have an experience. I think the imposter syndrome is real. Don't let it get to you.
Thank you, Anne.
Yeah, we had a wide-ranging discussion from dental hygienists to therapists providing ABA, and I'll just mention a couple of things. One, the potential for having a master's program at UNE to really help with the supply of dental hygienist therapists, which can really fill some much needed gaps in terms of access. And then also main care coverage for adults for dental is of great concern as a change in administration is due to happen. So getting in front of that is an important thing. And then Advocacy Day was raised. So that is occurring at least for some of the schools and some of the professions. So tapping into that. And then one of our participants from Simmons, she's a therapist, and raised the concern about insurance not having a consistent coverage of ABA, which makes it, or that the ABA is covered and like for Medicaid only for certain diagnoses where it really is should be more widespread. So just we could probably have talked for another couple of hours.
Yeah, thank you. Marissa?
Yeah, we talked. We had dental hygiene, dental medicine, Quinnipiac, and UNE. We did talk about the role of kind of engaging and linking up with the student organizations at UNE and how much they do. Talked some about one of the issues people are really concerned about is access to good care for people in rural areas, and tons of different state and federal kind of solutions to that. But really also just talked about like sharing patient stories with legislators and insurers and different people, because the people who are on the ground seeing patients every day and really seeing these issues, I've even had like Shelley Pingree office tell me, like, tell us what's going on, because we don't know if we're not there. You're our eyes and ears to bring us the concerns that people have. And so those stories, like Anne said, you don't need to be an expert. You're the person seeing the patients that are going to help everyone get an insight about what's happening. And we're kind of all relying on hearing those stories from people.
Excellent. Thank you. These are all excellent points. And we have so many more other points in the chat from all the rooms we have. Thank you very much for posting them. Just to mention a few of them, shared advocacy is stronger than siloed voices the different professional worldviews and perspectives, but we still have shared goals. I think that's really important to understand, and especially as we come from both the patient side and the insurance side, in the end, we really do share similar goals. Room 11 also talked about how they advocating in their practice, whether it's attending trips to further their knowledge on hot topics. Thank you so much for that. That's excellent. Lack of physician availability was another comment, especially in primary care, that leads to an increase in access barrier. Excellent. These are all excellent points. I would like to take a moment and thank everyone for their attendance and their participations. Please, we have a few more minutes before we can conclude. Are there any specific questions or specific elements to pass on as we conclude? I'm looking at our panelists. Anything we'd like to add?
I would just say thank you. I think that it's really important. I know, Marissa, we kind of talked about this earlier, that it's important to show gratitude, but also to take time for yourselves. I know that this is a really crazy time. It always feels like it's crazy times. I think it's a privilege to say this, but I think it's still important to find pockets of joy, whether that's a sweet treat in the morning, or maybe not this clinician group, but I love a sweet treat in the morning. So I would just say to remember to find joy in the small things, and just thank you all for showing up.
Yeah, we have a really amazing state, and honestly, what I always tell our members is we punch above our weight in what we do, and we're a better state for access to care than many other places, and it's because of the particularly collaborative and civic-minded nature of Mainers. The fact that so many of you are here today is really a testament to that, and so just keep doing things like this where you just show up.
Thank you.
And I would add that advocacy work, you have to think of it as a long game, and how important it is to cultivate relationships, even if it's someone you see as an adversary on the issue that you're dealing with today. They may become your greatest ally on the issue that you have tomorrow. Or I've also seen ways that, we might be on different sides, but we come to some agreement that then sails through the legislature. So just that mutual respect is so important. And I think it's something that we usually see on display in Augusta. So unlike what we might see in DC.
Yeah, yeah.
Well said. Thank you all. This has been an amazing, amazing discussion. I am so thankful for your time, your efforts, and your kindness and understanding. I would like to thank everyone for attending. Please do let us know how we did by completing the participation and attendance survey. The link is in the chat. Please join us next Wednesday, February 4th from 12 to 1 for another session, Screens Down, Eyes Up, Understanding the Myopia Epidemic and Reshaping Care, an interprofessional presentation about one of the biggest threats to vision health in the 21st century. We're introducing colleagues from the New England College of Optometry, and it's hosted by UNE's Graduate and Professional Studies Masters of Public Health program. Details can be found in the chat. We appreciate your attendance to all of our events. As a reminder, your participation may be applied toward your IP Honors Distinction application, which demonstrates your team readiness to your future employers. All CAIEP events are available for inclusion in curriculum. Thank you so much, and I hope you have a great rest of your day. Goodbye.
Could you guys please put an updated attendance link in the comment section? I can't seem to find it.
Sure, Chris will help us with that. Thank you.
Thank you, everyone, so much. I really appreciate you.
Thank you.